We've learned more than 40 rural hospitals here in Louisiana, including a half dozen in Acadiana, are in danger of closing if cuts contained in that bill become reality. That's because the bill would cut billions of dollars in healthcare spending. The loss of that funding could gut many rural hospitals that disproportionately rely on federal money.
One of the most expensive services is OBGYN services. So if a hospital doesn't have that, are you going to have young people moving in who want to start a family? Well, no, because the hospital doesn't have those services. But even more than that, people are employed by these rural hospitals. You have people who are part of that community. And once that hospital closes, you have that kind of central community that's lost, and there are no real institutions to be able to replace that. And so that's kind of the biggest thing, is that the rural hospital closures lead to a community decline, not just healthcare in individual or households.
And so if we begin to cut that lifeline, then people are going to die. And so the message for our policymakers is to think about our Louisiana residents, think about access to health care, and think about the needs of communities in our state.
When a rural community loses their rural hospital, it is the death knell of that community. How are you going to attract business and economic development into a community that does not have health care services, and you've got to travel great distances to receive those services?
The U.S. Senate narrowly approved these hospital funding cuts today, with both Louisiana Senators John Kennedy and Bill Cassidy voting in favor of the bill.